In this lesson, we're going to talk about joints and their structure and function. So with any good A&P lesson, you should start with the function and the structure of the joint, but we also need to figure out what the purpose of a joint is. So the main purpose for joints is that they're going to allow for movement between bones. And as we get going through these joints, we need to think about what the important parts of a joint are. We need to look for potentially the amount of movement in between the two bones. We need to look at the tissues between the joints. Also, we need to see if there's a presence of a joint cavity, and that's going to give us more information about how the bones are supposed to move either separately or in unison. So let's look at the different types of joints. And when I talk about joints, we're looking at different types of classification. So you have several different ones. You've got amphiarthroses, you've got synarthroses, and you've got diarthroses. So here are examples of some. So with amphiarthroses, like here with the vertebra, you have submovement, but there's not a particular cavity. And when I say cavity, I'll show you what I'm talking about. We're talking about something like a synarthrosis. So you've got, or a synarthritic joint, which is this, where you've got no move there. You cannot move in between the two bone structures. And then you have diarthroses, which are movable joint cavities filled with fluid. This is an example of a knee. This is an example of a diarthrotic joint. So now we're going to look into the complexities of diarthrotic joints. So this is not a comprehensive cumulative list of every type of bone or joint class, but these are the majority of the time. This is the majority of types of joint classes that you're going to see throughout the body. The three different joint classes that we are going to look at. You've got the hinge joint, the ball and socket, and the planar. So the hinge joint is an example of this is going to be your ankle and your elbow and your knee. They move like a hinge on a door. Your ball and socket is going to be something like the hip or the shoulder, or you actually have an area where you've got the socket and then you've got the ball, which fits inside of it. And then you can have rotation and movement. The hinge is just like it says. You've got this, and rotation occurs this way. Then you have planar. These are your wrists and ankles. So the hands and your wrists, they can literally move. Here's one, and they can move like this. They can move between each other or by each other, but they don't necessarily have to articulate on one particular angle. So when we're talking about like the structures of a diarthrotic joint, this is really important too. So you have a joint capsule. You have an outer layer of the joint capsule, and you have an inner layer of the joint capsule. The outer layer is covered in the white functional connective tissue and other fibers, whereas the inner layer is a little bit different. The inner layer is going to have something called a synovial membrane. You have areolar and adipose connective tissue, and then you have synovial fluid. And synovial fluid is really important for any sort of joint capsule that has a synovial membrane. What the synovial fluid does is it provides a cushion and lubrication for the joint to move fluidly. Another really important part of anatomical structure of joints is that you can have these things called bursa. And what a bursa is they're fluid-filled capsules, and they are identical to the joint capsule. So you've got the outer membrane, the inner membrane, and they have synovial fluid. But what they do are a couple of things. They reduce friction, they allow for free movement, and they also provide the cushion between the bones and the tendons, and sometimes muscles. So here, this is what's called a prepatellar bursa. So this is the patella, this is the patellar tendon. You have the fat in kind of in the joint area. Then you have this area right here, which is the prepatellar bursa. So this, what it's doing is it's allowing for cushioning so that if any impact occurs directly to the patella, it doesn't damage it. So let's recap. So what defines a joint? Well, a joint is an area of two bones where they meet, and there's an articulation, and it allows for movement. You have several different types of joints. You've got three of them: the amphiarthrosis, the diarthrosis, and the synarthrosis. You have your diarthrosis classes. So you've got the hinge, you've got the ball and socket, and you've got planar. And then you've got synovial fluid. And that's really important because it lubricates and cushions the joint. And then you have bursa, which is another type of cushioning, and it helps to reduce friction, and it improves movement in between the bones and tendons. That's it for our lesson on joints. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.